So hello everyone, I am Atula, student of TYBPT, and here to speak on topic posterior dislocation of hip. So let's begin with the introduction. So when the head of the femur slips out through the capsule and displaces according to the direction of force is known as dislocation. Dislocation of hip is a serious injury. There are three types of dislocation. First is anterior dislocation, second one is posterior dislocation, third one is central dislocation. So today we will be speaking on posterior dislocation. So it is a commonest type of dislocation. 50% of cases associated with the chip fracture of posterior lip of acetabulum, in which cases are known as fracture dislocation. It occurs when adducted and flexed femur is pushed backwards with a violent thrust to the knee. So now let's move on to the causes of posterior hip dislocation. So the first one is road traffic accidents. In that, the dashboard injuries are very common. The second one is fall from the height on flexed knees. The third one is motorbike accidents. The fourth one is high impact sports injuries. The fifth one is industrial trauma. The sixth one is post total hip replacement dislocation. And the sixth one is weak bones or maybe osteoporotic bones. Next thing is clinical signs. So in that, the first one is local pain or tenderness. The other thing that we should see is for the attitude of the limb, that is it should be flexed, adducted and internally rotated. The other thing is shortening of limb. Next is stiff and painful attempted movement. The other clinical symptoms are localized hematoma, palpable posteriorly in gluteal region, diminished or absent femoral artery pulsation. So the next thing is investigation. So in that, the first one is a head out of acetabulum. The second is thigh internally rotated. The next thing is lesser trochanter less prominent. And the next thing is Shenton's line is broken. That is an imaginary line that is drawn on the pelvic tracing the curve of the inferior border of the pubic ramus. The next thing is look for any bone chips. So the next thing is treatment. So in that, the first one is reduced under local anesthesia by classical Watson Jones axial traction technique. The another thing is if it is old dislocation, then we should be doing an open reduction. The immobilization should be for 6 to 8 weeks, and the mobilization starts after 6 to 8 weeks. And the last thing is complications. So what all can be the complications? So in that, the first one is avascular necrosis. The second is injury to sciatic nerve. The third thing is osteoarthritis, and the fourth one is myositis ossificans. So that's it for today. Thank you.